Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. This is part 3 to safe blood and blood product transfusions. Again, the message is to reinforce JCI, Joint Commission International Patient Safety goals, not just 1, but this time 1 to 5. But most importantly, identify the correct patient is International Patient Safety Goal number 1, and that's most important with a high risk procedure, which is a blood transfusion. The learning objectives for this session are, we'll do a pre-knowledge review again, subsequent transfusion considerations, additional transfusion considerations, transfusion cautions, and consider JCI, Joint Commission International, their safety guidelines. Question 1. Which of the following is the universal recipient blood group for packed red blood cells? O, A, B or AB? The correct answer is AB. Which of the following is the universal donor blood group for packed red blood cells? O, A, B or AB? The correct answer is 0 or O. Which of the following is the universal donor for the blood group with plasma? OAB or AB? The correct answer is AB. Question 4. When thawed, fresh frozen plasma should be transfused immediately or within which of the following time frames? A, within 24 hours, 20 to 24 degrees centigrade. B, 24 hours if kept at 2 to 6 degrees centigrade. C, within 5 days if kept at 20 to 24 degrees centigrade. D, within 5 days if kept between 2 and 6 degrees centigrade. The correct answer is B. Which of the following is the shelf life for packed red blood cells if stored correctly in a blood fridge? A, B, C or D? The correct answer is 5 days. Question 6. Which of the following is the IV solution of choice to infuse concurrently if required with a blood product? Normal saline, lactated Ringer's solution, half normal saline or 5% dextrose? The correct answer is 0.9% normal saline. Now if we look at subsequent transfusions, what does that mean? Well, we're giving more than 1 unit of packed red blood cells, for example, or we're giving numerous other products. In that situation, it's recommended change the blood product, administration set and filter every 4 hours or after every 2 units of packed red blood cells. Additional considerations are as follows. If blood has to be released in an emergency situation, it can either be class 1 or class 2. Class 1 means uncross-matched blood, being packed red blood cells, can be delivered typically within most organisations from the blood bank or the transfusion unit to a patient in 5 minutes or less. Uncross-matched blood is typically O-RH negative, and look, it can be O-RH positive. O is the universal donor, RH negative is the universal donor, and typically it's reserved for females less than 50 years of age because they are of childbearing age. If they're older than 50, which can be debated in relation to having children, O-RH positive blood is typically recommended. if you've got emergency blood release class 2, this means in most organisations, cross-matched blood, packed red blood cells, can be delivered to a patient in 15 minutes or less. Additional considerations relate to specific cautions with patients when giving a blood transfusion. So when it comes to neonates, they're typically at risk of transfusion-associated circulatory overload. And the abbreviation TARCO is a common transfusion reaction in which pulmonary edema can develop as a consequence of fluid overload. This can also occur in children, geriatrics, any patients with cardiac comorbidities can be overloaded. It can occur in patients with pulmonary comorbidities and renal comorbidities. So let's review. What do you do if you suspect a transfusion reaction? Common sense. Stop the transfusion immediately. Don't leave the patient. Notify the most responsible physician. Maintain IV patency with normal saline. Don't remove the IV cannula. You may need it. Record vital signs every 15 minutes and check the patient's ID blood product compatibility label and notify the blood bank immediately. Now let's consider which Joint Commission International patient safety goal must be applied to ensure safe transfusion practices. Well, the answer is we have to apply International Patient Safety Goal number 1. Identify the patient correctly. And if you look at the literature, we are still not identifying patients correctly. And as a consequence of that, there are medical errors, one of which could be the wrong blood product may be administered to the wrong patient. What are some of the other JCI International Patient Safety Goals that could be applied in this situation? Well, from my perspective, I think all of them. We've mentioned International Patient Safety Goal number 1, identify the patient correctly. Improve effective communication. Well, this is really to do with checking the blood, really. It is. Independent double checking, including the patient, if possible, in now the checking procedure. International Patient Safety Goal number 3, improve safety with high alert medications. Blood isn't a high alert medication, but it's a high risk procedure. So therefore, it could be included here as well. And with all high alert medications, we always do independent double checking. Ensure the right procedure, site, patient. International Patient Safety Goal number 4. Well, make sure that the right patient is getting the right blood product in the right procedure. You're ensuring it's the right procedure and the right patient. And the 5th one, reduce the risk of healthcare associated infections, well, which could be related to the blood product, hepatitis, HIV, numerous other infestations. Now let's just review what we did in part 1, ABO compatibility, because this seems to be an issue with a lot of nurses and healthcare providers that are responsible for transfusion. Which of the following regarding RHD positive blood is correct? A positive donor blood is compatible with an A positive recipient. Is this correct or incorrect? It's correct. B negative donor blood is compatible with an B positive recipient. Is this correct or incorrect? It's correct. A positive donor blood is compatible with an AB positive recipient. Incorrect or correct? It's correct. O positive donor blood is compatible with an O negative recipient. Absolutely incorrect. O negative donor blood is compatible with an AB positive recipient? Absolutely, it's the universal donor. Let's summarise and review again. Which of the following is the universal recipient of blood group for packed red blood cells? O, A, B or AB? AB is the correct answer. Which of the following is the universal donor blood group for packed red blood cells? Donor. OAB or AB? It's O, the universal donor. O negative, the most universal donor. Which of the following universal donor blood group is for plasma? OA, B or AB? The correct answer is AB. Which of the following is the shelf life for packed red blood cells if stored correctly in a blood fridge? 5 days, 3 weeks, 2 months, 1 year? 5 days is the correct answer. Fever, diaphoresis or sweating, hypotension, chest pain, back pain, anxiety, dyspnea are signs of which type of transfusion reaction, typically? The correct answer is hemolytic, an acute hemolytic reaction. What is the first nursing intervention if a transfusion reaction is suspected? Call the doctor, do vital signs, stop the transfusion, hold the patient's hand. C, stop the transfusion. A transfusion reaction is most likely to occur within what time frame after commencing the transfusion? 3 minutes, 15 minutes, 30 minutes, or 60 minutes? The correct answer is 15 minutes. Which of the following is the IV solution of choice to infuse concurrently if required with a blood product? 0.9% normal saline, lactated Ringer solution, 0.5 saline solution, or 5% dextrose solution? The correct answer is A, 0.9% normal saline. Which of the following patients have a high risk of fluid overload post a blood transfusion of packed red blood cells? Cardiac patients, elderly patients, children, or all of the above? The correct answer is all of the above. Neonates, pediatrics, geriatrics, cardiac comorbidities, renal comorbidities, pulmonary comorbidities. With multiple transfusions, a patient is at risk of which of the following conditions? Hypothermia, hypocalcemia, hypophosphatemia, or hypokalemia? The correct answer is hypothermia. Thanks again. Thanks for following this review. This is the end of part 3, safe blood and blood product transfusions. Now, if you felt that this was of any benefit to you at all, please suggest it to your colleagues and review some of the other Dr. Manny Learn Shops. Bye for now.